Good afternoon, everyone. Thank you for being here. We'll go over some data, give some assessments, some information for everybody. Then we'll take some questions. Unfortunately, we have lost another neighbor over the last 24 hours, African-American male in his 60s. To date, we've now lost 195 residents to COVID-19 since this pandemic started. So certainly want to think of this individual, their family members, and please keep them in your thoughts and prayers. Looking at some new cases and testing. Since yesterday, we've received 1,708 tests for Onondaga County. Our mandate for the region, 775 tests a day. Our region reported 2,253 tests since yesterday. We do have universal testing at the Syracuse Community Health Center, 9 to 5. Certainly your primary care providers and various urgent care sites are also doing testing, as are hospitals. Testing is a challenge, and it's a challenge in our country right now with turn times. We are actively communicating with new labs that we haven't been working with, bringing these labs into our community to work with some of our community partners to speed up those turn times. And we're looking at those. We believe we have made some improvements, hopefully this week, towards that, and we'll continue to have those conversations so that we are getting data as quickly as we can so we can contact trace as quickly as we can. So that's something that we acknowledge. It is not something that is unique here to Central New York or New York State. Everybody watches the news, the TV, the newspaper. We have a pandemic problem in 50 states across the United States of America that has driven testing in all these states. They're doing what we were doing now. They're trying to get ahead of the curve the way that we did, and so the labs are backed up. So this is something we're going to have to grind out, and we're going to need people to be smart more than ever now, wearing your mask, physically distancing, sanitizing, because the infrastructure is a little bit delayed, and it's going to take us some time to get through it. So certainly we're going to need everybody's participation and help in this process. Looking at hospital numbers, 46 in the hospital, same as yesterday. Out of the 46, 27 individuals from a memory care facility, a dementia unit. Again, it was deemed necessary when we had outbreak in this facility that the best place for these folks to get treatment and to avoid spreading it to other residents was to be in the hospital. This does not mean that these 27 individuals need hospital care. That was a decision that we all made. We know at least 20 patients are now ready to return to their facility, their nursing home, pending a negative test. Certainly when you take these factors in, we have under 20 people in the community right now with COVID-type symptoms that need day-to-day hospital care. So our hospital infrastructure is in good shape, and that's certainly really good news for the community at large. When we look at folks, we have 5 in the ICU now. Please keep these folks in your minds, your thoughts and your prayers. They're in a fight, and certainly we need them to get better. Looking at positive cases, 37 new cases. Out of the 37, 7 household contacts of previously confirmed cases. These individuals were in a quarantine already. No new contact tracing efforts needed with these folks. 6 of the new cases are affiliated with senior living facilities or group home facilities. 2 senior living, 4 of a group home that had previous cases. What do we know about the virus now? We know if it gets in a building, it's very hard to get it out of the building, and that's why you see some of these things happening. We had group home cases a couple of weeks ago. Now some more people have gotten tested in that group home. We're getting positives. Again, many of these cases are often asymptomatic, but positive regardless. Community spread, we have 18 community spread, 13 out of the 18 we know the source of the community spread, 5 out of the 18 we do not. I want to give you some examples of what we see related to a community spread. Many of these examples are folks just doing things, but shows you how deadly and risky the virus can be and how infectious it is. Close contact to a positive, a friend visiting from out of state, no mask. Family funeral in a neighboring county, which then led to multiple positive cases at that family funeral. Exposed at a 4th of July party. Exposed at a 5th of July party. Travel, New Jersey, Florida, North Carolina, Massachusetts, all separate cases coming back into the community. Exposed via an employee. Exposed at a graduation party. Had lunch in a workroom with somebody in close proximity, not wearing a mask. Exposed while working at a group home. These are different types of things that we have. The reality is with this virus is we're going to have exposures. It's here. People are going to get sick. So we need to understand that. We don't need to panic when we have cases. We need to really assess were there things that we could have done to change the outcomes and get better moving forward. That's the reality. We're presently monitoring 313 active cases. That's up 34 from yesterday. We had 3 recoveries yesterday. We now have 2,600 people who have recovered from COVID. When we look at our cases, 1,816 female, 1,285 male, 221 are under 19, 514 in their 20s, 424 in their 30s, 373 in their 40s, 464 in their 50s, 371 in their 60s, 283 in their 70s, 252 in their 80s, and 156 in their 90s. We've talked about our averages, our weekly averages since restart. Last week, I think we were averaging about 28 cases a day. So far this week, we're about 22 cases a day, a little bit better. When we break down these numbers, 27% of these cases so far this week were community acquired where we know the source. 25% were from congregate living facilities. 20% were from household contacts. Remember, the household contacts come because most likely somebody got a community spread case. So 15% were community acquired where we do not know the source. 9% were related to travel. So essentially 10% of these cases are new to our dynamic. We weren't seeing travel-related cases in the beginning of restart. This is going to happen. People are going to travel. They're going to go to different places and come back, some within New York, some outside of New York. But overall, the reality is this hasn't really impacted our hospital numbers at this point. Additionally, 44% of the cases are under 40 years of age. That goes to what we've been talking about. Folks who are more social are getting this. They are not getting as sick. Why do we still harp on you? You get it, you don't get that sick, is because you are in an isolation for 10 days. That's disruptive to your life. Because of you getting COVID, there are many people that you know and you like and you love that are now in a quarantine for 14 days. That is very disruptive to their life. Those folks in quarantine, we know 15% of them will then most likely become positive with COVID. They may not have the same reaction to the virus that you have. This also has a drag on our economy. We know to get school started, we have an infection rate we have to hit. Your case, even though you're healthy, leads to a higher infection rate. So when we say we are all in this together, we mean it. There's a cause and effect that happens with every single case related to COVID-19. And it's going to be like this till we have a vaccine. So what we need to do is we need to do what works. We need to be smart. We need to be diligent. We need to respect the virus. If we do those things, we'll starve the virus together. Looking at this, couple reminders. We don't even need to have the reminders, but certainly physically distance when you can. Wear a mask if you're not going to physically distance. If you're hanging out with your friends, I get it. It's inconvenient if you're hanging out with your friends to have a mask if you're close together and then have a cocktail. I understand it. I've been there. we need you to do that. We need you to respect the virus and understand that that virus can be incubating in somebody you know for a period of time. There's risk when we're together. We need to live with the virus. We're doing that. We're restarting our economy. We've built up an infrastructure to keep this community safe, but we still need to be smart. So, saying that, I'll take questions. Yeah, it's a challenge. I think it's really going to be a challenge for the next 30 days. We have a lot of important things happening in the next 30 days when you talk about colleges going back with students, when you're talking about getting ready for school. Testing has to be a piece of that. So we've had some of the labs we brought on have better turn times. We're rearranging the deck. Well, some of these other labs, some of your larger labs, your brand names are building on capacity. We've spoken to other testing labs and companies, a little more non-traditional in the way that they bill. It's more of a direct cost to counties or colleges to get the tests. It's not a billing system, but we're looking at making those investments because we need to make sure that somebody who's symptomatic is getting a test and we're finding out quickly if they have COVID or not. What I would be interested in is, and we don't have this data, remember we were testing just symptomatic folks in the beginning part of this process. There was other respiratory illnesses, and so 8% of our tests at one point were positive because 8% had COVID, 92% had something else respiratory-wise. Now we don't have that respiratory illness. But we're testing universal-wise. I'd be curious to see what that symptomatic test rate is now. I'm sure it's very high. But these are all challenges that we have, and we need to make sure that we need to basically assume if you're symptomatic, you have it. That's why we have our executive order where the folks have to be in quarantine. But we're looking at all options to make sure that we stay on top of this. And we found new lab partners that we're putting in touch with the various colleges as well. Their model's different than the other models, but we need plan B and C if we're going to be bringing back 15,000 kids to the community soon.
Could you just say a little bit more about those different billing models? What the county might have to pay directly for tests?
Correct.
Why can't they bill insurance?
I guess we could if we had the feeling that we could build up that infrastructure for billing. We don't have that now. So it's something that, Tim, that we may spend short-term dollars to get tests in the hands of folks that will test people who they believe have COVID for symptoms. That 24 to 48 hours to us is very valuable at boxing in the virus, and it's worth the money in my opinion.
When you say that 44% of cases are under 40, is that cases actively?
Yeah, so okay. Cases this week. Out of the 91 cases so far this week, 44% are under 40 years of age. Again, driving this, you have, remember, you have a 14, it's really a 7 to 10 day incubation period, could be as long as 14. Go back 14 days, July 2nd, July 1, 3rd, 4th. Fantastic weather, holiday weekend. People were partying, okay? We saw the pictures. People are party hopping. And because of that, you had friends who were exposed together, but then they exposed other friends and other friends. And we've been messaging to everybody, get tested. If you're in those groups, get tested. They're doing that. Many of these cases are asymptomatic with the young people, but very disruptive, and still they're infectious, and that's leading to household contacts. And you know, some of these household contacts are mom and dad, and mom and dad aren't in their teens or early 20s. Mom and dad are in their 40s or 50s, and everybody responds differently to this virus. Nobody's 100% safe. In other states, there's lots of reports about young people. There was a report in Texas about a kid who went to a COVID party to get COVID, and he died 24 hours later. So everybody's different. This virus impacts everybody different, and it's disruptive, and it's deadly for many of our residents.
Going off of the community spread, we've heard and reported that some school districts, their sports teams might be gathering having practices. Any words of encouragement on people having practices, even though shouldn't. They probably shouldn't.
Well, first off, I think people need to just follow the rules and the guidelines about what's allowed for practices or what's not. I get so much information at me each day. I don't know what sports are allowed to be doing what at this time. But the cases of somebody who may be affiliated with a sports team getting COVID, it's going to happen, okay? That's not the end of the world. What then happens, and a reminder to the public, if someone gets COVID, we figure out the day they were symptomatic. We then go back 2 days from that standpoint, and we start our contact tracing at that point. If the public does not hear from us, our health department, that means we are very comfortable with the contact tracing efforts. Now, that doesn't mean that the media is not going to hear about it from a parent, from a text, from something else, and you'll investigate it, and someone else will confirm it. But that does not mean there's risk to the public, though, because you guys find the story. So in the case of a coach recently that was reported on, I think by every outlet, we did our research, we did our tracing, we're good. We're going to have school. We're going to have times where kids or family members or a teacher gets COVID. We're going to go through the same process, and we're going to be okay. This is living with the virus. And certainly in this one case, we're pretty comfortable. We know where everything stands. Our investigation's complete.
How can you punish someone who breaks rules like that?
What rules? What are you talking
The
about?
state rules about practicing and gatherings. It seems like something like this where you see a lot of cases.
I don't know the specifics of if they were breaking the rules or not. I haven't. If you're saying they were, I would confirm that. But I don't. People, nobody's ever had to live through restart rules and regs. I don't know if they were having full contact, if they were coming up as a team and doing running and training, but they're under 50 people. I don't know what the circumstances were. I do know the circumstances of the investigation into the case, and the investigation was thorough and complete, and we didn't put out a press release.
How much, I assume you're talking about the FM coach. How much spread was there, though? Did you, is there a cautionary tale in what happened there, or?
I don't, at some point, there will probably be a cautionary tale. In this case, there was not one. Very comfortable with the contact tracing efforts, and that everybody who was exposed based off the timeline of when they had symptoms 2 days before, that in this case, everything's fine. We're okay.
And you said you're not aware of any rules that were broken in terms of mask wearing or how they operated?
I don't have those details. I was more concerned with when I read about it, where were we related to contacts and how thorough was our investigation. I feel really good about where that is.
In response to Governor Cuomo's new regulations for restaurants and bars, what about those bars that can't and don't normally serve food? His new regulations say that in order to serve alcohol, you have to serve food. What about the restaurants in Onondaga County who don't?
I anticipate there will be a lot of creativity. There will be a lot of very good specials at some of our restaurants. 25-cent chip night, I think, will be going along. In some of our establishments, Doritos might be 15 cents, pretzels maybe even cheaper. I think what we see is there's other regions of the state that are having a problem. Diverse state, we're going through. But what we have done, remember, restaurants and bars for us are the easiest to regulate. Why is that? Because we already regulate them from the food standpoint. Our health department knows them, we see them. We got many complaints early on when this first started. Bands, dancing, very close dancing. We went out, we fined, we educated. We know that many of these traditional restaurants, till a certain hour, then become bars. They've done a very good job with limiting the number of people in their facility, sitting people down at a table, and making sure when you're at the table, no mask, but if you get up, you have to wear a mask. They've done everything that's been asked of them to date. And so I'm sure they will comply with this. Again, I don't know what drove the decision-making process from the state on this. I learned about it when you learned about it. And so it's a state reg. I think it's an inconvenience. I recognize that. But I do believe that once we see the regs, there will be the ability for these businesses that more of their business after certain hours is more beverage-driven than food-driven. I still think there will be wiggle room for them to operate. There should be.
So no economic concern?
Of course there's economic concern. These are business owners that have been on the sidelines. They have another regulation. I understand New York City's behaving badly. That's what I'm being told in our control room calls. But we need to figure out ways to keep the economy open. I can tell the public 100% confidently today, we have not had any outbreak related to restaurants or bars. Zero. That doesn't mean that won't happen in the future, but right in our community, we have had none. We've been following that very closely. And so I think you're going to, if there's stringent food, I don't know how you regulate this, right? They're not going to say you have to spend so much on food to get a beer. What happens when you're done eating your food? Are you not allowed to buy a beer then? I mean, these are the types of things that just don't make sense. But I do get the concern that you don't want dozens of people lined up around a bar when you're trying to physical distance and starve a virus. We haven't had that problem here. When we've had the problem, we've fined bars. One of them voluntarily shut down because they couldn't keep people under control.
Have you seen the regulations from the state? Because it seems like right now
No.
it's another thing where bars and restaurants are really in the dark.
I have not seen them.
Did you talk about it at all on your call today?
I did.
What'd they say?
I don't know if they did not share them with us immediately thereafter. Hopefully we'll have them later. Again, I think this is being driven by New York City, and I get it. There's a lot of people. Tough thing to regulate there. I get it. Not so much here. We got it under control.
Back to testing, I've heard some turnaround times lately, like 7, 8, 9, 10 days. When do you expect that to improve? Do you expect that to improve with these new labs you're putting on your mobile?
Yeah, I think it will. I don't know the answer when it will improve for some of the brand name labs that everybody knows that are being used everywhere in every state. I know that those labs say they're building out more capacity nationally to deal with this crisis. Will, in our community, things get a little bit better because we're arranging the deck more, all of our partners, and we're rearranging different labs to cover different areas of concern that maybe are quicker in turn times? Yes. So we think it will get a little bit better with some of the things we're doing. Again, we don't have a testing facility the county runs. What we do is we manage the need in the community. We analyze it with all the health data, and we look at where there's gaps in the infrastructure, and we manage that infrastructure. So now we have one lab that's already doing work for us over here. There's still 3 to 5 days. We need you to now partner over here because they do more tests a day, and you're blending, some with this lab, some with the other lab, some with this lab, some with the other lab. And so that's how this thing goes. And this was a daily exercise for us in the beginning. Right now, it's a daily exercise for me right now and our team to make sure that we're on top of this, and then to make sure that SU has good options and Lemoyne has good options, so that when students come back in, we're utilizing good testing protocols, and so that we're safe. And that's what we'll do. And we'll get the job done. It's going to be an inconvenience for some people now, though. And I don't know specifically about it. What happens is you have various labs, and some of them get so backed up that it doesn't. Loretto's got to test every week. If somebody's at 9 turn time for 9 days, that doesn't work for Loretto. So we've brought on so many different labs in the community. I'm sure they probably partnered up with one of the new labs.
Are most of the tests in Onondaga County right now accounted for by testing of nursing home workers?
No. You have nursing home workers, you have elective procedures, any surgeries. In addition to that, you have at your doctor's offices, you're going to get more folks with symptoms and or allergies. Folks who have allergies, most people, if they go to the doctor, they're going to rule out COVID. Then you still have a level of proactive testing and a level of testing from close contacts. So it's a mix. If you look at our numbers, again, we're probably, I haven't seen an average on per day, but most days we're over 1,500 in Onondaga County.
Well, that's a lot, considering that, the community health center is only doing 300.
Yeah.
So this is mostly private doctors and other...
There's a lot of them are private doctors. It's a business now that they're involved with. It's a business model that they can make money on, so they're doing more of it. Remember, in the beginning, they weren't doing a lot of it. It was all new. Now they're comfortable with it. They're doing more of it. You have, in addition to that, your hospitals that are still doing proactive COVID testing as well, in addition to elective surgeries, which that's robust, Tim. I mean, you have a lot of weekly surgeries being done in this community where people are getting tested. And then you have your nursing home employees as well.
Have you had any issues with contact tracing? I know you said the other day that you were a little worried about people not answering the phone and not answering the questions.
I think we're okay right now. Overall, so there was a group of, you always get worried when you have a large group of young people that's impacted, that they're going to be honest. This is something that, you don't ever want to shame anybody because they get sick. Was there unforced errors? Yes. Were they doing things that they should have known better? Yes. But for the most part, when young people get it, they're going to be okay. And so we had concerns that maybe we weren't getting the full story from some of the kids. We're comfortable with that now.
Any update on the mobile testing for school sites, or?
We worked individually with some of these schools that were impacted most, and we had them tested at a different facility, and that has driven some of the positives over the last few days.
Have you had to make an example out of anyone breaking quarantine?
I don't know where the investigation is with our law department with that. We have we've beefed up our enforcement unit. Now we have another investigator on, probation on, that does these types of tracing investigations. So we have more complaints. Glad Walmart got in the game with masks. That's good. That will save us, probably 20 complaints a day if they enforce it. But we have these complaints. Now we have a more strategic way of addressing these complaints. And fine letters went out to big box stores, and their corporate lawyers are now calling us and asking, saying they want to comply now. So hopefully these big box stores are all going to be in compliance. There's other local grocery stores that people thought weren't doing the compliance for mask wearing. They are. They tell me they are. They're committed to it. So hopefully the mask wearing gets better in the community when people are especially out in facilities, and some of these complaints stop.
How are you dealing with contact tracing for asymptomatic, patients? Because you said it goes back 2 days for the symptoms. They don't have any symptoms.
Yeah, so if you test positive with no symptoms, right, we're going to run 2 days before that still. But I'll give you an example. Out of the 37 positives today, 43% are asymptomatic. So our under 40 number, essentially many of these people, and Tim, to your point, where's the testing? Who's getting tested? They're getting tested because we're saying go get tested. And so that's a proactive test in most cases, or a contact. We're going through and we're ready to put people in quarantine. They get tested. So that's a big number of asymptomatic cases. So where is that good related to our data? It's good because it's probably not going to impact our hospital numbers. Where is it bad? It's bad because we now have to track these 7 household contacts because we don't know how sick they're going to get. And you're disrupting people, and they have to go into quarantine. Now they got to go out of work. what's going to happen to that small business owner that needs that employee working? So this is a really, regional challenge for every part. It's more than just public health. It goes into your economy as well.
Is that 43% asymptomatic? Is that typical of what you've been seeing, or is?
That looks a little high for today. But again, if you look at many of the cases today are driven by community spread, known community spread. So that's kind of our clusters of young people. So that's what we're seeing with a lot of young people, is they're asymptomatic.
Just going back to the school districts, the FM superintendent said that the practice or the workout was not authorized and that they went to a public park outside of this. And I know that you said the investigation was thorough and it's complete, but I guess just moving forward as schools start to reopen, as we look toward the fall, is there any concern with people having practices when they shouldn't?
Well, you should follow the rules. So I don't think if you're at a park, if people are getting together for, depending on what they were doing, if you're getting together for a pickup basketball game, which happens, it's against the rules right now. I don't know what they were doing. They're saying it wasn't a sanctioned high school event. Okay. What I'm concerned about isn't them throwing a football around at a park. It's when the individual did the individual have symptoms, or was he within the 2 days before he had symptoms, did he have contact with the team? We're very comfortable who he had contact with and who he didn't have contact with. So just because you're a coach and you get COVID doesn't mean all your players were around you when you had symptoms or 2 days before you had symptoms. So this is something that I understand. It's kind of a nice thing to report about and ask questions about because it's an interesting area and there's potential exposure there. We've been doing this a long time now. We are comfortable that everybody who had direct contact was notified. We're very comfortable that the students were not in a position where they need to be in a quarantine.
What school districts did you work with to try to get their students tested?
I'm not going to get into the specific districts, Tim. Certainly, there are multiple districts that we had conversations with about knowing who, where they went to school, and then they went to different parties. So there's multiple districts that were involved.
When it comes to the travel cases, have you found that people with voluntary quarantine are supposed to be 14 days when they get back if they come to the States that are on this list?
Yeah, now that the infrastructure that's been built up by the state now is a little bit more helpful for us to enforce this. So we believe they're doing the right thing and they're quarantining while they're here, and then they're going to eventually leave, probably before 14 days, right? Not many people come here and then are there for 14 days. So your business travelers coming in and out, there's ways for you to be deemed essential, and there's guidelines for that. If you're coming back into the state from another part of the state, you're going to quarantine, or from another state on the list, you're going to quarantine. But some people will come into the state, and I'm sure they leave before their 14-day quarantine for whatever reason, or there's some people that just aren't coming to the state because they know they have to quarantine. So if you're planning on coming to New York for a week vacation and you know you're going to be stuck, if you come to New York, you don't come, is what most people do.
Have you been testing the inmates and the deputies at the jail, and are there positive cases there?
No positives at the jails. There's been testing. Any new person that enters the jail also gets tested.
What happened to the plan to go through and test all the inmates, though?
I believe that I will have to confirm that all the inmates were tested, but I believe they were tested, and I know that any person new to the facility gets tested as well. But I will have to confirm with you that they were there. I have an executive order on record saying that was to happen. Other questions?
On a different subject, do you have an opinion on what should happen to the Christopher Columbus statue in Syracuse?
Yeah, I support the mayor's effort to have a dialogue with all parties concerned about the statue. And I think that will be a healthy exercise, Tim. I think people need to look at this issue through everybody else's eyes and try to see if there's common ground. The statue to the Italian-American community in our community, we need to put things in context. And the context is this came up in the 1930s. Italian immigrants who have made significant contributions to our community. Significant. We have a significant Italian-American community in Onondaga County. And we wouldn't be who we are without those contributions. When that statue went up, the intent had nothing to do with the 1400s. It was a symbol of the contributions that the Italian Americans have made in our community. So the context is important in this, and I hope folks get to that, and I hope folks listen to the other viewpoints that they don't agree with, that maybe don't agree with them, and they learn. I think no matter what, the circle needs to be a dedication to the significant contributions of Italian Americans, no matter what. And so at some point, if this group comes and they have recommendations, whatever happens after that, that area in our community has been dedicated to those contributions. That needs to continue to be the same. So I think the mayor's on the right track with this dialogue, and I think hopefully everybody learns from each other. The traditional efforts with the indigenous people and the Italian American, the traditional back and forth on this, it doesn't necessarily need to be an either or. We can recognize the history and complicated history of everything, and I think the best place to do that is sitting around a table and talking through these things.
Do you have the right to cancel large events? Like in Philadelphia, I know that they canceled kind of everything and then said no fans at events, and like running the War Memorial and stuff. Do you anticipate having to make that decision if the AHL doesn't come in and do that themselves?
I do have the right, and I haven't thought about that. I shut down a parade earlier this year, St. Patrick's Day Parade. Celebrates the great contributions of Irish Americans, which I'm one of them. Certainly you can't have anything over 5,000 people in normal times. It needs a mass gathering permit from the state health department. So right now you have an executive order which the governor has a mass gathering at 50 people. So right now you could probably have a game. You just won't have that many fans in the stands. So whether that works for the AHL business model, I don't think it does. But certainly, if we want these types of things to happen, we need to starve this virus much better than what we're doing now. And then the data can be your story. Look at the infection rate. It's not 1 or 1.5. It's 0.001. Why can't we have some of these events? That's a better argument to make than we should just be able to have the events. The virus doesn't get young people sick. Okay, it gets some people sick. It doesn't get all the young people sick, but they get people sick, and then they're out of work for 2 weeks, and those businesses then suffer because they can't afford just to hire somebody for those 2 weeks. So the best way to get our economy back 100% is to starve this thing better than what we're doing now. And we've done a nice job now. I saw some of the recommendations. I was involved with that process before. You're very limited with what can be done. There's lawyers there that tell you what you can do. I think this process has been very politicized. I think the process has been very politicized, to be honest with you. So you have one political party who lost an election not wanting the other political party to draw the lines, and they won an election. Okay, That same political party isn't saying to the state, who controls, their party controls the redistricting lines, give up your power. It's all politics, and it's all noise. And so both of them have been barking at each other. Nobody cares about that. We're in the middle of a pandemic. And so they need to, if they made promises, was the issue with this. Did legislatures make promises, and what were those promises? If you made promises, you need to keep your promises. But nobody ever came to me and said, here's my plan, will you support it? And we have a role. The executive branch of government has power in that process. And they were taking away the executive branch of power, the checks and balances. So nobody ever came to me and said, are you okay with your branch of government's power being taken away? Which tells me, serious to a degree, a lot of politics. Anything else? Okay. Well, thank you for being here. We'll continue to get the information and the data out, and let's continue to be smart and starve this virus. Thank you.